So one of the issues we should really consider is from a human side. There's a concept called population health. Population health is a concept that's now pervasive throughout the world, where all countries are not just looking at the health of the individual. It comes from a concept now called value-based healthcare. And I'm going to introduce these terms, but I'll try and define them as we go along. What value-based healthcare means that you get value from your healthcare system. You get value for what you spend in healthcare. You can measure those results. They say what you measure gets improved. So one of the things that we are concerned about here in Grenada is our ability to measure what our healthcare dollars are doing. And that system is not in place currently in Grenada, and one of our hopes is to help put these measurement systems in place to be able to analyze the effectiveness of what we do.
So you mentioned about the value-based healthcare, a measurement system to be put in place. How would that be done?
So one of the key ingredients of measurements is having a coding system. I know that there has been measures with the new electronic medical record system that's been put in place. They're starting to use some coding system, but the ability to code every disease, every diagnosis, every treatment that's being utilized gives you the power to collect data on individuals. Just having an ID number that you could track people, track illnesses, track events, encounters with the healthcare system gives us a basis to understand one, cost, and the other, effectiveness. We are also interested in what we call measurements of quality, whether or not we are providing quality healthcare. And I know that's a very difficult thing to do in our small nations. But nowadays, doctors graduating from medical school, nurses, all of the allied healthcare professionals take courses in quality healthcare and quality management. So it's very critical that we introduce these measures in our system. And I know in today, our healthcare system is emerging. And many of these issues we need to bring front and center and provide training and education to our current healthcare workers and future healthcare workers. I think where we are today is that we have healthcare operations with a cultural basis that exists for many years that we've not been able to change. And I'm not, having been trained overseas and practiced in a different country, I could come back and say there is room for us to make some significant improvement, and I think that that's possible. I've had encounters with the people in the current system, and they are on that train. They really want change. They would like to see improvements to the healthcare system, and certainly the public is really crying out and saying we need better healthcare. So I do believe that this initiative through national health insurance would help to revolutionize the way healthcare is delivered. One more point I'd like to make on this. National health insurance cannot be a band-aid. It has to be a transformative system for this to work. We have to change a lot of things. Not just, everybody thinks it's the government, or it's the doctor, or it's the hospital, or it's the diagnostic centers, but it comes down to every one of us as individuals having a passion for this. I believe healthcare is a national treasure like anything else. Think about the Grand Etang. That's a national treasure. The Annandale Waterfall, all of those are national treasures. Healthcare in our country should be treated as a national treasure for our people. And I really believe that if we take that focus, the political establishment, the business leaders, the common man in the street, we could make a huge difference in allocating the resources necessary to take care of our people.
So if we talk about what NHI seeks to promote, would it be some of the points that you just raised? And in the beginning of your presentation, you mentioned about the mortality rate. Would we say that what it seeks to promote is also one where we can link longer living as opposed to, people dying at an earlier age?
Absolutely. Uh, Internationally, we track longevity as a function of good healthcare. And very important that this exercise be put in place. I do believe we have a system already in place. And I'll tell you, public health wise, Grenada is not far behind many other nations. Particularly when it comes to things like vaccination of children in school, primary health care, we've done a lot in this country. And as we've researched, there's been work done. So we can't be just critical and say things are not there. Where we have challenges are in the specialty areas, in the areas where there is catastrophic issues. So clearly, we want to be able to provide this type of service so that in the long run, we'll be able to ensure that people live longer and healthier lives.